Martin Luther King Jr. is quoted as stating, "Of all forms of inequality, injustice in healthcare is the most shocking and inhumane." In our society, inequality is evident in healthcare systems along with inequity. Those who are often neglected for proper healthcare often lack the status, power, and money that those privileged have.
The healthcare system is an organization that assists with maintaining and improving human health. A healthcare system refers to a service or program by which healthcare is made available to the population. It is financed by the government, private enterprises, or both. These services and programs may be delivered in defined settings such as homes, educational institutions, workplaces, public spaces, communities, hospitals, and clinics.
Individuals on top of the social hierarchy having the upper hand in healthcare systems should be given the same treatment as those who are in the lower social hierarchy, for everyone should be given the services they need to be satisfied. Every one of their social statuses should be treated with respect. Those in dire needs to be on the top priority.
Every citizen in every country pays taxes to receive all kinds of benefits from the government. Healthcare services, safety and security, retirement plans, and many others. Some people pay higher taxes because of their contribution to the country. Thus, this gives them privileges such as power, title, money, and more. With this, some people are treated as important people. Therefore, they are always the first ones in line when challenging callings such as the recent global event pandemic. Also, all people in society were served by healthcare system, but the process took a long time resulting in significant casualties. This made people look and hope for free but fast healthcare services that would cater their needs. Communities during the epidemic reported ongoing food shortages and problems with nutrition, sanitation, and health. The biggest issue in the Philippines, particularly in the beginning, was the lack of PPEs and medical supplies.
43% of the world's wealth is owned by 1% of households as of October 2021. They are wealthy. On the contrary, barely 1% of the world's 8 billion inhabitants, the poor, own more than half of the world's wealth. For every 10,000 people, affluent countries have 55 hospital beds, more than 30 doctors, and 81 nurses. In a less developed country like the Philippines, 7 beds, 2.5 doctors, and 6 nurses are available for the same number of people.
In conclusion, individuals in every nation pay taxes in exchange for various government advantages, including retirement schemes, safety and security measures, and healthcare services. Because of their contributions to the nation, some people are subject to higher tax rates. As a result, they gain benefits like authority, wealth, and other things. Because of this, certain people are given special treatment and are always first in line under challenging situations like the current pandemic that has affected the entire world.
On the other hand, vaccinations are provided without charge in the Philippines. In the Philippines, there are numerous locations in which one may receive vaccinations. The fact that immunizations are free makes this vaccination drive a significant comfort. Individuals aim for universal vaccination. Knowing that Filipinos will finally receive vaccinations is a relief. Dr. Patrick Javier, a medical volunteer, says that there is a stigma associated with homelessness, so we work to make people feel as accepted as possible and to ensure that their circumstance does not prevent them from receiving vaccinations. They ought to receive vaccinations just like everyone else.
A 2-day vaccination campaign in Manila, which successfully immunized over 630 people, was a part of a larger initiative to assist local government units throughout the Philippines, collaborating with non-governmental organizations to ensure vaccines are provided to at-risk populations like homeless, survivors of gender-based violence, and others by ensuring they have access to COVID-19 vaccines. The drive included transportation, lunches, childcare, immunization, and details on COVID-19 in addition to these additional services.
In conclusion, the healthcare system in the Philippines has advantages as well. One of these is free coronavirus immunization. There are several places where one may be vaccinated. This vaccination program is a huge comfort because the vaccinations are free. People strive for the widespread immunization. It is a relief to know that Filipinos will finally obtain immunization. By ensuring that people have access to COVID-19 vaccines, the Philippines, in conjunction with non-governmental organizations, ensures that vaccines are supplied to at-risk populations like the homeless, survivors of gender-based violence, and others.
People who have money and power should have the same benefits and services as those who don't. Since it is ethical to provide health care until it is necessary, have hospitality towards all patients despite their social standing, and give priority to those patients who are in desperate situations.
People on top of the social hierarchy are prioritized in the healthcare system since they provide the government with more money for services and pay more taxes. Because of this, those who lack both money and power are in critical condition are often treated last as they cannot pay their way for these services. Free services are given to those who cannot afford them, but these are often given later than the paid ones, leading to many casualties. These services are given later because the system offers them first to people who can pay for them and who are on top of the social hierarchy, showing clear discrimination and inequity. Only some people have been given enough services to satisfy their needs. The biggest issue in the Philippines, particularly in the beginning, was a lack of PPEs and medical supplies. During the outbreak, communities reported persistent food shortages and nutrition, hygiene, and health issues.
The Philippine healthcare system comes with numerous benefits, but it is filled with many injustices and flaws. The population had been granted free services and programs, but on later notice to give way to those who are privileged enough to pay for these services. Is it right to prioritize those who can afford it and think less of those who do not? Shall people accept that those in power are given early access to healthcare systems and free services later to those who cannot afford them? What would happen if the system reached out to people on the lower social hierarchy too late? And what more casualties will it cause?